Welcome to the Health Daily Show. I'm your host, Chitra Nabat. Joining us today is Jason Gorevic, CEO, Teladoc Health. Jason, thank you so much for joining us.
Chitra, thanks for having me. Happy to be here.
Challenging macroeconomic environment. Your business has got two sides, B2B, D2C. Competition is intense and plentiful. Telehealth saturated. There's lots of startups right here at this conference that are in the telehealth business. Patient acquisition, tough, expensive. How do you get stickiness? Recessionary environment, inflation, and over the past year, your stock has been diving around 75%. How do you keep pushing through these headwinds to growth? Top three areas you're focused on.
Yeah, I think for us, it's all about the mission, right? Our mission has always been about taking care of the whole person, delivering care on the consumer's terms, moving the needle on health outcomes, and driving down cost of care. And so if we focus on those things, we'll continue to drive record growth. And we just announced today our 50 millionth visit. 50 million visits in the history of the company. People always said virtual care was all promise and no reality. I think we've proven that that's not the case. And with us delivering 17% year-over-year growth, we're proving that it's a reality and that we're moving the needle on cost of care and, more importantly, on health outcomes across the entire spectrum of an entire person's healthcare needs, not just one small sliver, which is what you see from most of the small startups that are exhibiting here today.
So when you talk about then, how do you bring these ingredients together to drive this kind of growth, to drive this level of 50 million visits? How do you orchestrate these ingredients? Like, what's different?
For us, it's about the integration and the breadth of the care that we bring to bear for the consumer. So a consumer doesn't think about themselves as, oh, I'm a diabetic, or, oh, I suffer from depression and that identifies me and defines who I am. They think of themselves as a person with a holistic set of healthcare needs. And it's why we have continuously built, acquired, and innovated to broaden the spectrum of the healthcare capabilities, leveraging underlying data science, delivering it with the best human resources in healthcare professionals, but also really intuitive, holistic technology solutions.
So, holistic, integrated care, this is a goal for Teladoc. I wonder if that's too good to be true, right? Because I remember back in the days of Pioneer Village when there was only one doctor for the entire village or community. That doctor had to know everything about you and figure out how to keep you holistically well. Here we are today, so many years into the future. There's lots of technology. There's a doctor for almost every part of your body. So how do you, if not every part of your body, so how do you really bring to life this concept of integrated whole person care?
So it's not just a goal, it's a reality. Right? We've been pushing hard on Primary 360, our virtual primary care product. And the data is showing that consumers are leaning into it who have been disenfranchised from the healthcare system. So the data shows 60% of the people who engage with Primary 360 haven't seen a doctor in over 2 years. We have an 87 Net Promoter Score on Primary 360. Find me something else in the healthcare system that has an 87 Net Promoter Score. And we're delivering care across the entire spectrum of care. So 1 in 4 people who we're treating for cardiometabolic disease through our Primary 360 is newly diagnosed. These are people who would have had exacerbations, they would have become uncontrolled diabetics, or risk serious hypertension escalation, and we're catching them early. But it doesn't just end with their physical health, you have to integrate mental health. So it turns out that when somebody engages with mental health resources through us, in addition to our hypertension program, we drive down an additional 10 points of systolic blood pressure. When they engage with our mental health in addition to diabetes programs, we drive down an extra 0.5% of A1C and 2% of additional weight loss. So when I talk about holistic, real whole person care, that's what we're delivering, and that's what the consumer wants. Nobody knows, do I need an endocrinologist? Do I need a cardiologist? Do I need a gastroenterologist? People shouldn't have to know that. They should just know that they need care.
So the pieces that you're talking about take us into a journey to value-based care, because Teladoc, you've evolved from being fee-for-service point solution, and I want to come back to the point solution point a little bit later, to this journey of integrated whole person care that's risk-based. So where are you on that journey, and what's your pathway to scale?
We're deep in it. I mean, we're willing to put our fees at risk for moving the needle on health outcomes because we're so confident in the underlying data science and the clinical science that we know that we can move the needle on the critical health measures. But I think it goes beyond that. Like my point about people engaging with Primary 360, we're starting to talk to health plans and employers about maybe the old measures of success, the old metrics of success for healthcare aren't the right ones. Maybe we need to be talking about how many people are we really engaging. And so we put our fees at risk every day because we're confident that we can make a difference in the healthcare consumer's life.
So what do you say then to many of the entrepreneurs, the founders that are out there, the startups, hundreds, thousands at this conference, who are trying to do something in telehealth versus where you are? It's a very saturated market. Your thoughts?
Yeah, I mean, I think the days of point solutions are over. The consumer's expectations have shifted to really wanting whole person care. I mean, you know, we were talking earlier about Walmart, right? People want to go to Walmart because they know that they can take care of all of their shopping needs, not just a portion of it. You know, we're not a boutique, we're not a single point solution, we're a whole person care solution that's really gotten to scale and efficacy and a great consumer personalized experience. It's very hard to build scale when you're doing that on a single narrow point solution. And what I hear from buyers, employers, health plans, even hospital systems, is that they're tired of having to do the integration themselves. And look, I mean, we're in a challenging, as you said with your opening question, we're in a challenging economic environment. I think there's going to be a big shakeout of those companies who don't survive because they're not adding enough value for their clients and consumers.
Value. Let's talk about Livongo a little bit. A lot of founders, a lot of companies out there aspire to be a Livongo. You acquired it for $18.5 billion in 2020, making it the largest digital health deal ever at that time. Early this year, you wrote it down by roughly 30%, and that pulled down your stock by nearly the same. What did you learn from that?
So people ask me all the time, like, Jason, would you do it again? Right? And the absolute answer is, without a question, unequivocally yes. Because strategically, you can't be in the business of whole person care. You can't have a value proposition that says whole person care and not take care of people for their chronic conditions. Now, they also ask, would you have done it at the same time that you did it? Right? It was in the middle of like truly the lockdown pandemic. It made it incredibly difficult. Right? We couldn't get in a room. We couldn't run our playbook for how we do integration, where we get all the leaders in a room together, give everybody a bear hug, and we start working through integration on day one. Did that make it harder? Absolutely. No question it made it harder. Would I have done it again when we did it? Again, without a question, yes. Because at that time, the consumer's expectations were shifting and the strategic chessboard was moving, and that was the right move for us strategically, but it was also the right move in terms of adding value and meeting the consumer's expectations.
So now then shifting into making it more productive, extracting value.
No, I mean, we are bringing to bear all of those solutions. We think about on-ramps to the Teladoc Health ecosystem, right? And an on-ramp can be mental health, an on-ramp can be primary care, an on-ramp can be urgent care, and certainly an on-ramp can be chronic care. But all of those have to operate together, and that's how we add the most value for the consumer. Because again, they shouldn't need to know the 30 different clinical solutions we have behind the curtain. They just need to know that they can come to us for the best healthcare.
To deliver that integrated whole person care requires a lot of data, analytics, information connectivity. How should many of the startups that are out there that are at this conference, how can they think about partnering and being a part of your ecosystem? What are those metrics and the attributes you look for in startups to add value and help you achieve your goals?
I always tell early stage founders the same thing. Just focus, right? Focus on what you do well and where you can add the most value, and don't try to boil the ocean. What I find from too many startups is they're too diffuse, they try to do too much, they don't stick to their knitting, and they spread themselves too thin. and that's a recipe for disaster.
Is there something specific, a couple of things that you guys are looking for right now to get help in, and any specific areas?
We're always expanding the scope of our clinical offerings because, again, whole person care isn't a destination, it's a journey, right? And so we have to continue to expand the scope of what we can do for the consumer. So we're always looking to expand the scope of that. Sometimes we do that with organic development. We're investing almost $400 million in research and development this year. So we do a lot ourselves, and we look for best in breed technology and clinical capabilities because we know sometimes that's a faster way to continue to accelerate the value that we offer.
Leadership, Jason. In life, in business, there are codes, norms, rules to how things are done. Where have you been a code breaker in your career and journey, and how did you do it?
I mean, we basically created the telehealth industry, right? We took on certain state organizations. We went to court 8 times with the Texas Medical Board, and we stood up for what's right. It's one of our core values. We have 7 values as a company. It's one of our core values to stand up for what's right. And so we believe that's not just the right thing to do, but the responsible thing to do. And to me, that's what defines leadership.
Jason, thank you so much for joining us.
Chitra, thanks.